Welcome to Sam Says So, where Sam says so. My name is Samantha DK. I'm your host, of course, and I'm here because I want to talk to you all a little about professionalism in nursing and then my experience during my nursing practicum course. According to the American Association of Colleges of Nursing, otherwise known as the AACN, professionalism in nursing is described as the formation and cultivation of a sustainable professional identity, including accountability, perspective, collaborative disposition, and comportment, which is just behavior that reflects characteristics and values of nursing. One major takeaway from the video on professionalism in nursing is that professionalism is pretty much acting your part. I believe this is a good way to describe it. When you maintain a professional appearance, you have to remember that you are there to work a job, and everything you do or how you present yourself is allowed to be scrutinized. If you come to work in inappropriate attire, disheveled, you have a nasty attitude, and you speak to others in poor manner, negative beliefs could be and will be created about you. This can hinder your ability to do your work, to provide effective care to your patients, and it will also decrease your ability to work effectively with your fellow staff. Nursing professionalism is a process where you are continually growing, and you must have emotional intelligence to be able to communicate your opinions in a non-apprehensive manner, and then you must be able to control your emotions and not react out of them. To be a professional nurse, you will also need good communication skills, the ability to work in a team, and the ability to advocate for yourself and others appropriately. You then must give back to the profession through avenues like mentorship, coaching, teaching for the development of others. The transition from being a nursing student to a full-blown licensed registered nurse with complete responsibility and accountability for patients can be a challenging and stressful process. Many hospitals have adopted residency and orientation programs for nurses to bridge this transition upon graduation. Another method that aims to help ease this transition are senior nurse practicum courses, which I'm actually in right now. In these courses, nursing students are able to go to a unit of choice, which is mostly the case, and work alongside a nurse preceptor. They pretty much follow the schedule of their given preceptor or preceptors, and during this time, they're able to apply what they've learned in their various courses into real life situations. So you all know we've learned how to place catheters and do certain skills, and now, depending on your unit and your preceptor, you will be able to do some of these on real humans. Practicum is important in preparing future nursing students for the profession and being able to obtain certifications when they get out into the real world. Scholarly research supports the importance of senior practicum experiences for future nurses. One literature review created by MSN and PhD nurses attempted to summarize data from multiple sources to gain information about the benefits of nurse practicum courses. Some things they found was that during practicums, the development in nursing skills and achievement of set learning goals helps build student confidence. Then involvement in the same unit increased student confidence when performing tasks. And then getting a chance to speak to physicians during your practicum experience helped increase communication comfort for future instances. My practicum experience has taken a lot of patience. I had to wait to be given a placement, and then I began during a time where I had multiple exams to study for, presentations to work on, and assignments to complete, and I was questioning how I would get my practicum hours done. But I began my experience very discouraged, and I was anxious on how I would manage my time, but at the end of the day, it all worked out, and I loved my unit, and I'm currently still in my unit, so I'm really experiencing a lot. The Senior Nurse Practicum course has been a great time to learn and begin to master my skills as a new graduate nurse. During my practicum experience, I am placed into the intensive care unit, and I'm able to see a variety of patients. I personally plan on becoming a pediatric ICU nurse upon graduation, so I was able to see a different group of patients, adults versus peds, in an ICU setting. Although the pediatric ICU world may be a little different, the high intensity and critical nature of the patient may be about the same. I believe this experience helped me to actually use the skills I have been taught in nursing school on real people. I got a chance to witness a cold blue and assist to take care of that patient, and I was able to place an OG tube into that patient, and we did a whole bunch of other skills on the patient. And I was also able to place NG tubes, Foley catheter insertion. I was able to perform medication administration, so intramuscular, subcutaneous, intravenous, and orally. I was also able to do glucose monitoring along with a whole bunch of other skills that, if I continue to name, this would be all day. But I also got a chance to assist in skills that were not touched on in nursing school. I believe that my practicum experience will facilitate my transition into the nursing workforce. I will enter my new graduate job just a little bit more comfortable in my ability to perform skills and my ability to present myself as a well-rounded nurse on my floor. Nursing practicum is important in preparing for your nursing career. If you're allowed to select your desired unit for your clinical site, you may be able to get experience in a unit that you have been thinking about working on upon graduation. I was blessed to be able to gain prior experience during my summer externship, and other students may have also had previous hospital jobs, but not everyone gets the same chance. So if that may be you, do not stress, because this is where clinical experience during practicum especially comes in. The experience you gain on the unit can give you an inside look onto what you may be doing as a registered nurse. I knew some people who were in between working in an emergency department or choosing a medical surgical unit. They were able to choose to complete their practicum experience in the emergency department, and this helped foster their love for the ED, and they have been able to choose to continue their journey here. Nursing students are then able to practice skills they have been learning and witness firsthand how collaborative interdisciplinary teams function. Overall, senior practicum courses are beneficial in fostering future nurses. Nursing students ultimately gain confidence in their skills, their communication, and in their ability to feel ready to be a part of the nursing workforce after graduation. I would love to hear how those of you who have had the opportunity to take a nursing practicum course feel regarding this topic. For those of you who have not yet taken this course, your time is coming. And I hope you are able to go in and achieve all of your personal goals during your own practicum experience. Continue to strive for success, and I will see you all in the next episode of Sam Says So.